Amanda with StraightSmile Solutions, here to talk to you a little bit more about orthodontics, orthodontic cases. And today we're going to be talking about periodontal disease and braces, periodontal disease and Invisalign. We're going to be talking about what this means. And if you've been told you have periodontal disease, can you have braces or can you have Invisalign? And ultimately, let me go ahead and tell you a little bit more. And I'm showing this picture because I don't know if this guy has periodontal disease or not. I'm seeing signs of it that may lead me to think that maybe he does have it, but he may not. So what is periodontal disease? Periodontal disease is a disease or a breakdown of the periodontum, which basically means the attachment of the gums and the bone to the teeth. So we're all born with a certain level of gums and bone attachment. It's no different than if you plant a tree in your backyard. You have to have a lot of dirt, right? Earth to keep it stabilized. And if you try to plant a really tall tree in just a tiny little pot, it's going to fall over, right? It's going to be kind of wiggly. It's not going to be stable. It's the same thing with teeth, right? Now, over time, our attachment or periodontum starts to disintegrate or break down. There are 80-year-olds with really healthy periodontum. They may have almost all their stability that they were born with. And part of this is due to genetics, and part of it is due to environmental factors. So there are certain things that you can do that will accelerate the breakdown of your periodontum. So for example, like smoking, like poor oral hygiene. If you have poor oral hygiene and you let calculus or tartar or plaque sit on the teeth, the acids will help to accelerate the breakdown. Once you have breakdown, it doesn't come back. All you can do is make the area more healthy so that there's no infection, so it doesn't continue to get worse. So you cannot grow your periodontum back. You can just make it more healthy so it's not getting worse, right? Once it's gone, it's gone. There are different surgeries and stuff that can add bone, add tissue, but that's a whole other story. So basically, I know that sounds super duper complicated. So you can get diagnosed with periodontal disease, but it could be active or it could be passive. That means if it's active, that means it's actively happening and you need to do something to stop it so that it doesn't get worse and make it healthy. So usually that means cleaning out the bacteria, cleaning out the plaque, cleaning out the calculus, cleaning out the food, removing any active infection. It might mean some localized antibiotics, stuff like that. Okay. Also, if your bite is not healthy, or the alignment of your teeth is not healthy, this accelerates the breakdown of the periodontum. So that's why we do recommend braces or aligners for people with periodontal disease so they can get their bite and their teeth healthy. So back to this picture. That was a long example, but you can see in this picture that clearly this bite is not correct, right? So those front teeth, lower front teeth, are supposed to be behind the upper front teeth because they've somehow got displaced, moved forward. Now the bite is incorrect, and I can flat out tell you this is accelerating the breakdown of the periodontum. So if this person already has active periodontal disease, this is going to get significantly less, and this patient will likely lose their teeth. So their lower front teeth over time, unless you A, correct the bite, or B, stabilize the periodontum, or most likely both. Anyways, so I think now you get the idea. So no, you cannot tell just from a picture if somebody has periodontal disease. You need your dentist to do lots of things. This will involve x-rays, a clinical exam, some measurements where they call out those numbers, all kinds of numbers, and there's healthy numbers and there's not so healthy numbers. And then you add all those things together and that tells you what's going on with the periodontal disease, okay? But everyone probably age 30, 40 has a little bit of periodontal disease. There's just past or present. It's just really hard not to, you know, because it's just part of the aging process. It stinks, but it's just there. So, but hopefully we're all passive. But in any case, yes, you should get braces. You should get periodontal disease. If you do, you should get braces. You should get aligners. If you have periodontal disease, your dentist will need to keep more of an eye on the case, make sure everything's still healthy during the case. Sometimes it may mean that you may need a cleaning every 2 or 3 months and a check during the braces. You may need a periodontist that's a specialist of gums and bones to keep an eye on your treatment to make sure everything's still healthy. So hopefully now you understand a little bit more about the importance of healthy teeth, bones, and gum during your orthodontic treatment. All right, any questions, let me know. Visit StraightSmileSolutions.com. I know that wasn't the most fun topic, but it's a really common question that I get on my website. So hopefully not only from patients, but also from doctors. And people don't quite understand it. So Message me if you have any questions. Doctors, you're welcome to visit StraightSmileSolutions.com. Make an appointment for a complimentary consultation. If you're looking for support to accelerate growth of orthodontics in your practice, don't forget to visit us. All right, have a great day. Thanks. Bye-bye.